Apologies for that delay. Well, good morning, good afternoon, good evening, wherever you are. I'd like to wish you a very warm welcome to this webinar on increasing resilience of populations to the impact of the COVID pandemic on their health and nutrition. My name is Dora Panagidis. I'm the team leader for the EC Food Fortification Advisory Services. This is being jointly implemented by Landell Mills and the Global Alliance for Improved Nutrition, or GAIN. We provide advisory services for advice in the area of food fortification to our colleagues in Brussels, particularly nutrition unit, also to European delegations in the areas of programming, policy, and also research. You can find more information on our website at toofast.org. That's two as in the number two, FAS.org. And we're very happy to, if you reach out to us. We thought that with this current pandemic, that it would be very important to share with you a little bit about the importance of micronutrients with respect to immune function, the importance of these sorts of interventions, particularly how this pandemic is impacting malnutrition, how it's increasing people's vulnerabilities, but then also what sorts of programs the EC is currently supporting in food fortification that we hope other delegations would consider in future programming cycles. So we have here international experts, we have colleagues working in country offices to share their expertise and experiences. So just so you know, we've invited delegations from the priority nutrition countries. We've invited colleagues in Brussels from various DGs, including Sante, Agri, and also ECHO, and also a couple of other countries who have expressed an interest in nutrition. So we hope that you will learn a little bit more about food fortification and how right now is an absolutely critical time to consider nutrition in your programming. So a few things before we get started. For the purposes of this webinar, just so you know, the term nutrient-enriched foods and biofortified foods is the same thing. I won't go into the details right now, but just so you're aware of that. You'll see in the program that there are two opportunities for Q&A. We would like to request that you put your questions in the Q&A box. If you go to the bottom of your screen, there's Q&A and then there's a chat box. So please put your questions in the Q&A box and any other comments in the chat box, and we will try to get to all of the questions. If we can't get to them, and regardless, we will be putting together a document with all of the questions and answers, so all the participants and invited persons will receive this after the webinar. We are recording this event for internal purposes, and we can share it with participants, just so you're aware of that. And one more thing, sorry for the Q&A. If it's directed at a person, please do mention who you would like to have that question addressed to. In the interest of time, I will not be going over the very impressive bios of all of our speakers, but we will put something together and share that as well. So with that, I would like to turn it over to Fadwa to say a few words of welcome. Fadwa is working in DevCo C1 as the Policy Officer for Nutrition.
Thank you, Dora, and welcome everyone. We're really happy to have you all. it's a very particular moment right now with this sanitary crisis. And it was really important for us to have this discussion now to try to see what we can do and how we can tackle the different issues linking health, nutrition together, and food insecurity, and try to see how we can learn from the field experience on different projects, and learn also from partners who have the experience on micronutrient deficiencies. So big thank you to all of the speakers in advance. Thank you to Saskia, who is the Executive Director of Micronutrient Forum. Thank you to Florencia from GAIN. And thank you to all the colleagues from the EUDs who are going to do presentations. Normally it should have been Leonard, who is the head of the unit C1, so it's the unit where I'm working. It should have been him who was going to do an introduction. Right now there's just a technical issue, he cannot connect. I hope that he will be able to connect a bit later so he can do his introduction. But for the moment we'll just continue as it was planned, and I will hand over to Dora, our nice moderator, to continue with the sessions. Thank you.
Thank you, Fadwa. Someone has connected. Leonard, is that you by any chance? Are you online?
Dora,
okay.
Are you hearing me? Because I'm working on my iPhone. I can't connect through the normal Zoom. There's a technical hitch.
Okay, Leonard, we're very sorry about that, but we're absolutely delighted that you were able to join in by your phone. So let me just say, well, Fadwa already mentioned, of course, but Dr. Leonard Mitzi is the head of Rural Development, Food Security and Nutrition Unit at the ECDG for International Cooperation and Development. So Leonard, yes, we look forward to your opening remarks.
Thank you very much, and I hope that you'll hear me quite clearly. So thank you to Fadwa, and thank you to my nutrition team under the steer of Elena Guarin. This for us is an important webinar. It's probably one of the first that we as a unit are organizing, and clearly the topic chosen on food fortification and nutrition-rich foods is very timely in the context of COVID. Now, we have been operating like that in the past 2 months. There's lots of research out there, not least from IFPRI, from FAO, from UNICEF. Lots of UN agencies are doing similar webinars. I think what we want to extract from today's event is where does the EU and together in a Team Europe approach, where do we want to work at country level under this area. About a month and a half ago, the European Union unveiled quite a big package on COVID to the tune of 15 billion. This is a global package which has both a health component and a socio-economic component. And clearly, what we discussed today is in the interface of both. It can clearly be in the health component, in the non-vaccines, non-diagnostic dimension, but it is also clearly in the socio-economic component. The work and research in the past weeks show that from an availability point of view, there are no major problems in terms of availability of foods, although clearly with lockdowns, there is a problem of access to foods and also inequality of access. We see it also in the European Union, we see it in the US, let alone in the developing world. So we would also like to hear from the different panelists and from the participants, as we are now in a bit of a deconfinement and new phasing in many countries where some lockdowns are also being dismantled. How do you see this process impacting access? And also there is a problem of pricing where some products are not available, where export restrictions primarily on rice have an impact on prices and on availability, although this is not really the problem with certain wheat and oils. Clearly problems, issues around currency devaluation, so we expect import bills to really increase. The issue of locusts in parts of Eastern Africa and Asia, lower remittances, debt rescheduling, and what G7 and G20 countries have discussed on debt, cash flows for SMEs, social protection, social safety net. So we are really experiencing a seismic shift, not only in terms of the global economy, but also in the food system. In the run-up to COVID, we, as international community, were discussing whether the food system needs resuscitating or rejigging. We were speaking about a broken food system. If we look at it from a more positive lens, I think this is an opportune moment to design a new local and regional agri-food systems to actually respond to what we have been experiencing in the last 2 months. Companies which are clearly operating still at relatively low operating capacity, where also there are shifts, structural shifts in diets, with reduction of diets on vegetables, on fish, and on dairy, and towards diets which are not necessarily healthy diets. If I were to synthesize between the risks and opportunities, clearly the risks are linked to the dependence on global value chains and how this actually has an impact on vulnerabilities, especially of the weaker parts of the value chain, issues around schools and closure of schools, so loss in school feeding. But I think what we need to extract also, giving it a bit of a positive spin, are what are the opportunities of the COVID experience. I think what we need to unleash more is the idea of e-commerce and digital. Sometimes it works, sometimes it doesn't work. So what are the good experiences that were sort of rolled out in a number of countries in the e-commerce, digital, and linking local suppliers through e-commerce applications? I think the idea of short circuits or shorter circuits. We speak about global value chains, but I think this could also be an opportunity to look more into the potential of shorter supply circuits, where food can be procured locally or regionally rather than internationally. I am putting a question, clearly not in any way criticizing or trying to belittle the potential of trade. Trade is important. The multilateral trading system is key. However, this could also be an opportunity for countries not to go into the food sovereignty or autarky dimension, but to look into local and regional procurement. Is there potential or not to procure locally, but also to have better intra-regional trade? We have a number of processes in the EU-Africa dimension, not least a recent communication of March of this year, and in the run-up to a possible summit, which needs to be confirmed in October. I think this COVID experience is and can be a triggering dimension to have intra-regional trade, which can also help in the food fortification narrative. I think also another potential is the area of agriculture research for development, where we see new potential pathways with the CGIAR, but also with local and regional research bodies, with universities on how to fortify wheat or maize, hence flour products, rice, sweet potatoes, cassava, sorghum, and bananas. So even in this area, not only from a socio-economic pure angle of how SMEs operate, but also how to create those blending and investment opportunities for local SMEs to flourish. And that is an area where we as Commission Services, with a number of parties, with our European Development Financial Institutions, but also with EFAD under the ABC Fund and our Agrify blending operation, can work more and can scale up on the basis of our recent experience, which remains relatively limited in the past 2 years, but also in the area of agri-research for development. So I think I'll conclude on that front, and clearly if colleagues have questions, we can try to answer them during the course of the day or in follow-up once we have, and tomorrow as well. It's an important day for Commission Services because the Commission College will adopt what is known as the Farm to Fork strategy, which is a key pillar of the European Union Green Deal, which we consider as part of the international response of an economic recovery, which is based on a green recovery process and hence on a new modality of how to tackle food systems locally, regionally, and even globally. So I think I close on that point, and over to you, Dora.
Leonard, thank you very much for those comments and very thoughtful points to consider. I think you gave us a lot to think about today and in the coming months. So thanks for that. I would now like to turn it over to Dr. Saskia Ozendarp, Executive Director of Micronutrient Forum, to give her presentation on the anticipated impacts of COVID-19 on all forms of malnutrition. Over to you, Saskia.
Thank you, Dora. So thank you for inviting me to this webinar, and good morning, good afternoon, good evening, everyone. My name is Saskia Ozendarp, and I'm the Executive Director of the Micronutrient Forum, which is an international expert organization and knowledge hubs on micronutrient malnutrition. And in this presentation, I will illustrate some of the anticipated impacts of COVID-19 on all forms of malnutrition. Obviously, some of that is still based on projections, and we are currently working with a large team of international nutritionists to a more clearly defined estimate of what the impact could be. And some of it is also therefore more theoretical, but I have also some evidence that was collected, as Leonard already suggested in his speech in the past couple of weeks as well. Now, last week, the Global Nutrition Report was launched, and this is a report that is published every year to track progress on the Sustainable Development Goals for hunger and malnutrition. And it showed basically that even before COVID-19, the progress towards these global nutrition targets was too slow, and it was deeply unfair. So some of these nutrition targets, such as anemia, childhood stunting, being too short for your age, childhood wasting, and overweight, most countries were off course to meet the targets in 2030. And in addition, there were significant inequalities in progress between countries and within countries. And so this was the case even before the pandemic hit, because these data were collected before the COVID-19 pandemic hit. Now, we know that the COVID-19 pandemic has an unprecedented threat to hunger and malnutrition globally. And I'm sure you've seen some of these headlines coming out recently that showed basically that COVID-19 could almost double the number of people with acute hunger by the end of 2020. An additional 130 million lives could be at risk, whereas it could result in an increase of 1.2 million child deaths towards the end of this year, or 6,000 children every day, particularly because of disruptions in healthcare systems delivering essential health and nutrition services to children, and an additional 7 million children stunted by the end of this year due to the projected declines in GDP per capita. So in addition, COVID-19 is thought to further increase inequalities. We will see populations that were already disadvantaged at the start of the pandemic to be more proportionally hit by the pandemic and the measures that are in place to control the pandemic. So it basically means that there is a real risk that the gains we have made in reducing hunger and malnutrition and in child survival over the past few years will be lost by the end of this year if if there no action is being taken. And there's a particular concern on micronutrient malnutrition, and that has to do with the availability of and the food supply chains of nutritious crops, as I will show you in a minute later in the presentation. And we already have seen that particularly in micronutrient malnutrition, there has virtually been zero progress already over the past 20 years, from 2000 to 2020. So here you see in this graph from last week's Global Nutrition Report, the anemia rates in women of reproductive age from 2000 to 2020, and it's basically stable, a flat line. There has not been any improvement. And now on top of that, the COVID pandemic hits. So what is micronutrient malnutrition or hidden hunger? Well, we know that 1 in 3 people worldwide are malnourished, and about 1.9 billion people are overweight and or obese, and these numbers are increasing, particularly also in low and middle income countries. An additional 150 million children are stunted. That means that they are chronically malnourished and they have a low height for their age, and this has lifelong consequences for these children's immune status, for their performances in school, and their later adult productivity. We also, but in addition to that, an estimated 2 billion people are deficient in vitamins or minerals. And these conditions can also overlap. So people who are overweight or obese can also have a micronutrient deficiency, deficiencies, and in fact are more at risk of becoming micronutrient deficient, particularly when they consume diets that are rich or over-rich in calories, but not sufficiently rich in essential nutrients. So here is a conceptual framework on how COVID-19 impacts malnutrition, and what makes this crisis unique compared to other emergencies that we have seen. Obviously, it's worldwide, so the scale is unprecedented, but it's also affecting and impacting malnutrition at different levels. We know that food systems, and particularly international food systems, may be disrupted. The economic crisis reduces income. Food prices, particularly of certain foods, and particularly the nutritious foods, may increase. The supply chains of foods and premixes that often have to be imported are being disrupted, and social protection programs could also be disrupted. And as a result, hunger and food security can increase. The access to nutritious foods declines. Poverty and inequity increases, and particularly women empowerment, and women are disproportionately affected in general during economic crises, and in this crisis in particular. In addition to that, also the lockdown measures that are in place in many countries have impacts on the health system and how they can deliver the health and nutrition services that they normally would deliver. So to give you an example, in the country of India, during the initial stages of the lockdown, all the growth monitoring and promotion programs were stopped in most of the states. So these programs are not able to deliver the nutrition services to women and children. And in addition to, due to import bans, the health and nutrition supply chains are also disrupted. And as a result, the coverage of the nutrition-specific programs is thought to go down. We know from previous pandemics, such as, for instance, the Ebola pandemic in West Africa, which is which had similar implications, but on a much smaller scale. We saw that the coverage of some of these programs was dropped by 45 to 55%. And that affects healthcare and hygiene as well. And as a result, diet, and particularly diet quality, is affected. So people may still consume, or may even more consume, foods that deliver calories, but not foods that delivers the right nutrients. And health and illnesses increase, and that will affect all forms of malnutrition. Now, during the past weeks, organizations such as IFPRI and the World Food Programme and UNICEF have collected some real-time data to see if these projections are actually happening. And what we have seen that is indeed that in Nigeria, during the lockdown, the poverty rates increased by 15%, and the percentage of GDP gained from the agri-food system also declined by 53%, despite the fact that the food supply was exempted from most of the lockdown restrictions. The WFP estimated that in East Africa, an additional 34 to 42 million people would become food insecure in the next 3 months due to COVID-19 and the measures that are in place. And this comes on top of 20 million people that were already food insecure in this region. And that was primarily caused by the reductions in income and by the increases in the food supply in some countries. So for instance, in Sudan, who is relying a lot on the import of grains, the food prices of staple foods the wholesale prices of staple foods have increased significantly from March onwards. And as a result, fewer households in these regions can afford a nutritious diet. Now, to better understand the impact of COVID on micronutrient nutrition, I would just like to remind you on all the intervention strategies that we have available to ensure people consume adequate intakes of micronutrients. And these intervention strategies normally would need to be implemented simultaneously for certain food groups that have high demands, require different types of interventions. Obviously, we can promote the consumption of nutritious foods and a diverse diet. And in times when there is a high need for nutrients, so for instance, young children under the age of 2 or pregnant and lactating women, the health system provides supplements. So for instance, pregnant women receive iron folic acid supplements or multiple micronutrient supplements, and young children receive vitamin A supplements. We can also fortify foods. Staple foods are being fortified. It's mandatory in many countries with iron and folic acid. Even here in Europe, we fortify salt with iodine. And then, as Dora explained, we can also enrich foods through natural breeding, which is called biofortification, or by improving the nutrient content of the soil, which is called agricultural fortification. And all these interventions in normal times have to be implemented simultaneously, particularly in populations that cannot afford healthy diets. But all of these interventions are also affected now by COVID and the mitigation strategies that are in place. We know that micronutrient malnutrition is strongly correlated with GDP per capita. So here you see that countries that have a higher GDP per capita tend to have a lower prevalence of hidden hunger or micronutrient malnutrition. And we also know that current projections predict a global decline of an average of 10% of the GDP. And in some low and middle income countries, this decline can be even larger. In addition, hidden hunger or micronutrient malnutrition is also correlated with dietary diversity. So populations that consume more nutritious foods as a percentage in their diet have a higher prevalence of hidden hunger. And And we know that dietary diversity is affected now by COVID, because it's particularly the availability of nutritious foods that is affected by the measures that are in place. And for this, we have to remember that nutritious foods are animal source food products, such as dairy products and milk, and fruits and vegetables. And the production of these foods tend to be very labor intensive, and therefore they are more impacted by social distancing. To give you an example, there are now early estimates from qualitative studies that in India and in Ethiopia, particularly milk consumption shows in urban areas shows a sharp decline because the mobile dairy sellers are not able to move around, and people are not able to come to shops to buy the products, and the milk supply cannot be transported in an adequate way from the rural areas to the urban areas. In addition, these foods are also more susceptible to perishing and food waste. So when markets are disrupted, particularly fruits and vegetables don't make it to the markets. Again, this is thought to be particularly an issue also in the urban areas. And then these foods are known to be more expensive to begin with, and therefore are known also to be the first to be dropped from the household menu when incomes fall. So with a decrease in income, we see that people tend to consume more, higher percentage of their energies from staple foods at the expense of these nutritious foods. Now, in addition, during this pandemic, as I mentioned before, also micronutrient intervention programs are affected or suspended. So to give you an example, the Global Alliance for Vitamin A has instructed their health workers at the beginning of the pandemic to suspend all their vitamin A supplementation programs for preschool children until the health workers could be adequately protected by PPE and other protection areas. And we know that the supply of the protection materials for health workers is particularly an issue in low and in middle income countries. Similar other programs such as micronutrient supplementation programs for pregnant women, and the distribution of micronutrient powders to enrich homemade porridges for young children that are typically distributed through growth monitoring and promotion programs are also disrupted. Large-scale food fortification programs are affected because of international supply chain disruptions that affect the availability of premixes, and the local lockdown measures affected transportation of premixes to the often small-scale millers and the transportation of fortified foods to the markets. Now, from the beginning of the pandemic and also during previous emergencies, guidelines have been developed how to manage micronutrient malnutrition during emergencies, and these are still partly applicable for this crisis as well. And in addition, many organizations, the UN, the Global Nutrition Cluster, and the Scaling Up Nutrition Movement have provided guidelines on how to manage nutrition, so guidelines for infant and young child feeding and for maternal nutrition during in the context of COVID-19. And specifically to address micronutrient malnutrition or hidden hunger, there's a set of recommendations in place now to scale up effective programs and interventions that we know work. So to promote as much as possible healthy, diverse diets, possibly accompanied by price policies or cash vouchers that makes it easier for people to purchase the more nutritious foods. The promotion of breastfeeding, of course, large-scale food fortification and biofortification, vitamin A supplementation and micronutrient supplementation during pregnancy should be scaled up. And in addition, it's being advised to now invest in integrated, innovative food system approaches that are less relying perhaps on some of these international supply chains, and also that have been shown some promise in pilot programs that they work to address all forms of malnutrition. Again, price policies, cash vouchers, eggs that has been shown to improve the nutrition in children, particularly young children, and improve growth in pilot studies. and lipid supplements that can be added to a porridge for young children. And then to monitor the impact of the interventions to further build the evidence base. So to conclude, yes, there are growing concerns on the impact of COVID on micronutrient malnutrition. And if we are not careful, we know that this pandemic could set us back several years in our efforts to deliver on SDG 2. But there's more and more now nutrition scientists across the world and nutrition experts across the world that have come together and that say this doesn't have to go this way, and it's our collective responsibility to prevent this from happening and make sure that we build a better and more resilient population and eliminate all forms of malnutrition by 2030. So with this, I would like to conclude the presentation, and thank you very much. Dora, over back to you.
Thank you, Saskia, for that very comprehensive overview. We'll now turn over to Florencia Vasta. Florencia is a Senior Associate for Food Policy and Finance at GAIN, and she also provides support to TOFAST. So Florencia will walk us through the increased vulnerability of low and middle income populations in the time of COVID. We are running quite behind schedule, so Florencia, if you could please do what you can to help us catch up a bit. Thanks. Over to you.
Sure, perfect. Can you see my screen?
No.
Not yet.
No, okay. Okay.
Yeah, got it.
Great. Okay, perfect. Great, well, thank you so much, and thanks so much for having me here today. I'll be presenting on increased vulnerability of low and middle income populations in the time of COVID-19. So I know we've all been bombarded by a number of news stories, but just yesterday I was watching a breaking news story on CNN, actually, of the impact of the COVID-19 pandemic on the US food supply. And the anchor was reporting that the COVID-19 pandemic is creating unprecedented impacts on the food supplies in the US, something that we haven't seen in a number of decades. And this month alone, the COVID-19 pandemic caused a food chain disruption, resulting in 2.6% increase in food prices overall. And that may not seem like a lot, but for presumably a pretty stable food supply, and yeah, it was really impactful and just shows the gravity of the issue that we're facing today. So eggs, meats, and fish, which are all sources of protein, as Saskia mentioned, climbed 4.3%, while fruits and vegetables hiked 1.5%, and breads and cereals 2.9%. So this is really important. The COVID-19 crisis is obviously generating widespread socioeconomic and health shocks, which, as Saskia also mentioned in her presentation, will undermine people's nutrition. This is going to happen especially for those who are already vulnerable to nutritional deficiencies, like women of reproductive age, adolescent girls, young children, older people who we know are very much at risk for COVID-19, and especially marginalized groups in the poorest countries of the world. And some examples of the impacts that COVID-19 is having on food systems and livelihoods already that we're seeing are, first, reductions in income, especially for the people at the bottom of the pyramid, especially those who are earning the daily wages. It's really undermining people's ability to afford safe and nutritious foods, diverse diets, and really increasing the reliance, as we already noted, on staple foods. Also, the food supply chain disruptions are also causing issues. The most severe consequences are for safe, nutritious foods, which tend to be the most perishable. So foods really aren't getting to where they need to be, and it's generating piles of rotting food in some areas and shortages with rising prices in others. And finally, there's also this interruption and overburdening of health systems and humanitarian responses, which is both undermining delivery of and access to essential healthcare and nutrition services. So in this presentation, I'd really like to just tell the story of vulnerability in the time of COVID-19. Some of the populations that are suffering from poor nutrition already will likely experience an accumulated burden from the impact of COVID-19 on our food systems. So on the bottom here of this conceptual framework, you can see that in green, COVID-19 is causing disruptions of food markets and supply chains, limiting the availability of nutritious foods, affecting families economically, and this is increasing vulnerability to morbidity and mortality here in red. This represents an accumulated burden on those populations in countries who are already experiencing acute or chronic food insecurity, or what are already considered in crisis on a daily basis, which is in orange here. They're already vulnerable to high burdens of micronutrient malnutrition, which is therefore increasing their vulnerability to disease, morbidity, and mortality, once again here in red. And here's a map where you can see the 42 nutrition priority countries, which I'm sure you're all familiar with. In the following slides, I'll continue to keep showing these countries of interest on the maps, since they're some of the same ones that are, you'll see they're hit the hardest by a number of factors, including malnutrition, food insecurity, and experiencing a lot of the economic and health impacts of COVID-19. So as I mentioned before, poor nutrition is already a significant problem for many low and middle income countries. And malnutrition in all its forms results from not only poor diets, but they're also linked to really failures in the food system. An important global analysis that was recently done by IFPRI, which is the International Food and Policy Research Institute, showed what we can already imagine is happening due to COVID-19. It's affecting families economically. With lower household incomes during these times, less families are able to purchase meats, fruits, and vegetables, all rich in macro and micronutrients, and they're relying more on staple foods. We're also seeing impacts on food markets and supply chains globally, which I'll delve into a little bit more later in the presentation. So, as I mentioned before, this represents an accumulated burden on populations who are already experiencing food insecurity. The FAO had developed indicators to measure food insecurity among populations globally. And they measure moderate food insecurity as people facing uncertainties about their ability to obtain food and have been forced to compromise the quality or the amount of food that they consume. Severe food insecurity is defined as people experiencing running out of food and sometimes having gone a day or even worse, a few days without eating. So in the following map, I'll show here countries who in the last year already were experiencing food insecurity before COVID-19. So as you can see here, the countries in the darker colors represent the countries with the greatest number of people that are moderately or severely food insecure. And these populations with food insecurity are, as I said, higher risk for malnutrition. Just this year, the Food Security Information Network released their most recent global report on food crisis, which is the measurement of the people considered in crisis as of 2019, so just last year. As you can see here on this right-hand panel, there's a number of key drivers of food crisis, which can include conflict or insecurity. It could include weather extremes or even economic shocks. This map here shows a global representation of the number of people considered in crisis or worse. And this is all data that, as I said, is before COVID-19. The darker colors represent countries with more food insecure people in crisis. And again, people in crisis and are food insecure are more vulnerable to malnutrition. And as Saskia mentioned again in her presentation, micronutrient malnutrition or hidden hunger is a lack of essential micronutrients important for proper growth and health in a population. A few years ago, an NGO called Sight and Life developed an indicator called the Hidden Hunger Index, which is actually defined as the combination of the burdens of zinc deficiency, iron deficiency anemia, and vitamin A deficiency in a country. And on the next slide, I'll show a map of the hidden hunger index by country. And here you see again some of the same countries that we're looking at, but this shows a global representation of hidden hunger index, where countries in darker colors have a combined higher burden of the 3 micronutrient deficiencies I mentioned before. And again, this is all data before COVID-19. So the world is already seeing the impacts on food systems as a result of the COVID-19 crisis. And that's clear even in the US, which I shared this CNN story about. Over the last few weeks, GAIN, the Global Alliance for Improved Nutrition, has been developing a series of situational reports that outline some of the effects of COVID-19 on food systems from a number of low and middle income countries. The report contains some secondary data analyses from FAO and other sources, as well as interviews with small and medium enterprises, or SMEs, as I'll call them, and with select GAIN country staff in 10 countries, I believe. The information is both a combination of anecdotal complemented by secondary data. So for now, it should be taken with caution, but it does really give us insights into the experiences regarding the food system changes resulting from COVID-19, and from which we'll probably be able to develop some trends and a better understanding and analysis of. So I'll invite you to read the report offline since I don't have time to go into the details, and I'll provide that link to the report. But here are some of just the major insights. I can provide some high-level highlights. On the left panel here, you can see that COVID was causing impacts on production volumes. Below that, you can see impacts on sales prices. In the middle panel, you can see that the price variations by country for foods, they range from less than 1% to almost 20% in Rwanda. And on the right-hand panel, you can see the perspectives from different people on the types of challenges COVID is presenting, such as sourcing, importing, transport of food, difficulty with staff getting to work, getting ingredients, etc. And these impacts are likely to continue affecting the food supply chains, and this will be probably resulting in changes by consumers, not only in their food purchase, and also probably in their sense or their experience with food insecurity. So for vulnerable populations already affected by food insecurity and malnutrition, this can really have devastating effects. So this is a global depiction of COVID cases worldwide. And as we probably all know, the world is still experiencing, unfortunately, increasing cases of COVID-19. So it's really an important time for us to focus on protecting these vulnerable populations who will likely experience the compounded food and health effects of this crisis the most. We know that many countries are beginning to reopen, but only a few have actually been able to, quote unquote, flatten the curve, as we'll see in these next slides. So here you can see the rates of increasing cases in Africa alone. The cases are nearly doubling in some countries every 10 days. And this is recent data. It's just updated from January 22nd up to May 14th, just last week. And in Asia, some of the countries have cases doubling every 1 to 5 days. And finally, in North and Central America, as we've all heard and can see here, there are such alarming increases in cases, yet people are still, reopening countries. This data is really showing us a clear and present danger of COVID-19 if trends continue to go this way, both for the health of populations and especially for the impacts on food systems. And so the impacts on food systems, on one hand, it's just one major aspect of the increasing COVID challenge on the most vulnerable populations I mentioned before. But to make matters even worse, or potentially worse, I should say, there are a number of mitigation strategies that vulnerable populations might not be able to practice as easily as maybe some of us are. We've all been told a million times by the media, by experts, practice social distancing, wash your hands, wear a face mask. So we know very well that these are some of the most important things that we can do every day to protect ourselves and the people that we interact with. But we know that in many low and middle income countries, especially urban areas and slums, populations are not only dense, but oftentimes multiple generations are living together under one roof. Not only is one person at risk of exposing themselves when they go out, but once they come home, you know, you're exposing an entire family potentially when these families live not only in close contact with one another, but very densely populated areas. So on this slide here, we show the darker colors, which represent populations with high density per square kilometer, where physical distancing may not be as easily practiced. And this is not subnational data. It does not represent urban slums or urban rural, but it does give us a little bit of a sense and the major headline or idea there. And another key mitigation strategy to reduce the vulnerability to COVID-19 transmission is hand washing. Low and middle income populations often lack access, as we know, to clean water, hygienic conditions. So this really creates an increased vulnerability to poor health and disease. And this next map shows the proportion of populations with hand washing facilities at home with soap and water. And the darker colors here show populations that have less access, according to UNICEF, to soap and water available in their home, and may not be able to practice this important COVID-19 mitigation strategy. I know myself, I'm washing my hands 10 to 20 times a day, and some people aren't able to wash their hands even a single time a day. So in summary, the COVID-19 crisis presents an accumulated burden on top of an already bad situation for malnutrition. These slides summarize some data about existing vulnerabilities, not all the data, which will have implications on future nutrition needs. And these vulnerabilities may be further exacerbated in a crisis such as the complex one that we're grappling with today. So we want to prevent, to the utmost extent possible, a decline in nutrition status for the most vulnerable people in the context in which we work. So, thank you.
Thank you, Florencia, for that comprehensive presentation. We only have 2 questions, and we're very behind. So I would like to propose that we not have this next Q&A, but we will keep those 2 questions. Hopefully we'll have time later to answer them. We'll go straight into the country presentations, and I would like to invite Olivier Machiels from the EUD in Madagascar to share with us his experiences with strengthening sustainable access to targeted fortified foods. Over to you, Olivier.
Thank you very much. Hello to everyone. I'm going to travel with you for a few minutes only to Madagascar. Not to see, unfortunately, its beautiful biodiversity and beaches, but to speak about a food fortification project named PFOA, a French acronym. Now, I don't know how I can move to the next slide. Okay. Okay, possibly this graph is similar to what we can read from other developing countries in East Africa. On the vertical axis, you have the percentage of prevalence of stunting. And from the horizontal axis, you have the time from 1987 to today and a projection to 2025. We can see that the rate of stunting is quite high in Madagascar for children below 5. From 2012 in Madagascar, we have observed an increase in the reduction rate. Still, we have not yet reached the target made by the government for 2021, 38% of stunting. and not to mention the WHO target for 2025. We are far. There is progress, but we are still far. About the PFOA project in Madagascar, some basic information. It's a 4-year project, which will end actually soon. It will end this year. It's implemented by the GRET NGO. It's fortunately a follow-up of previous activity, which were financed by the French Development Agency. It's a 3 million euro budget, co-financed, interestingly, by Monaco as well. The GRET is implementing the project with a quite unique setup, a social business company named NutriZaz. Zaza in Malagasy means children. The beneficiaries of the project are very well targeted. There are 3 groups: infants, young children, teenagers, and young women as well. And the project has a component that everything is made in Madagascar. So the fortified products are made in Madagascar. I will come to that later on. 4 main activities for the project. Rapidly, the first activity is the production and the distribution of locally made fortified flour named Koba Aina, and it is the target is 6 months old infant children after breastfeeding. No blah blah picture. This is the maize, the fortified flour. Sorry, it's not an instant flour. It needs to be prepared and cooked before distribution. And NutriZaz company is distributing. Selling actually the fortified flour to various places in Antananarivo as well as in other countries. The project is also supporting the installation of this kind of structure. It's actually a restaurant for babies where young mother can bring the children. They can eat some of the fortified flour. They can also weigh their children and get some advices on nutrition. This is distribution of the fortified flour. We can see children do eat it, but of course they do need it as well. We do observe during the distribution very young mothers. Some children also benefit, a bit older also benefits from the distribution. The second activities is to develop new fortified products for young children, 6 to 13, for teenagers, and also for young women. The project has launched a new cereal bar, including iron, calcium, and zinc. It's named Pobari, and this was launched in November last year. It is made from cereals, mainly from rice, but also with some chocolate to attract the young children from a famous chocolaterie Robert, a French company, but possibly not the best chocolate in the world. We all know that the best chocolate is coming from Belgium. Children do like it. They like it a lot. The distribution, however, has been disrupted with the COVID-19. The third main achievement is also, of course, the project accompanying the government of Madagascar in the development of norms and certification of the fortified products. In Madagascar, of course, as everywhere, we have a Ministry of Public Health and dedicated units on nutrition. The project also contributed to relaunch the National Alliance on Food Fortification. There is a National Action Plan 2017-2021 with specific objective for 2021, the famous 38%. I would say everything is in place. PFOA project is there among all those institutions, but still we observe that it is still quite difficult to progress and to move forward, particularly with the certification of fortified products. The fourth and last main activity of the project is to produce evidence. Fortified products are not only good to eat because they contain micronutrients, but we also need to show why they are good and what effects do they produce on the growth of children. So the project has launched a large-scale study, a biological effectiveness of fortified products. It all starts with group meetings where we explain, the project explain what will be the study about. And then some specific interaction with the mother and the children. We have a sample of 900 children, which are followed during 12 months. And the treatment of the study is children receiving fortified food or not, receiving wash tools or not, and also the responsive feeding. A very interesting study that will produce quite a lot of results and evidence. We also take regularly blood and stool sample every 2 months, and this whole job is made in collaboration with the French Research Development Agency, IRD. Concerning the COVID-19, now for the PFOA project in Madagascar, it came, of course, at the wrong time, if there is any right time for such a pandemic to come in. The last year of the project, of course, as we know, it's often the time when we double our efforts, we triple our efforts to complete what needs to be done. And with this, it's making things very difficult. Initially, as I think for everyone, with the lockdown put in place, all activities stopped. And the project started thinking, okay, what could we do as a social project? We requested, the delegation requested the project to think ahead and to start brainstorming about what could be done. If I try to resume this in a table, in Madagascar, we have a lot of know-how on malnutrition. The perception of the project is that we are good at the job, we know how to do it. All our products are coming from Madagascar, so we have a national identity there. But with the COVID-19, simply, we cannot do it. And there is a big, of course, question mark, it has been mentioned before, on the supply chain. By the way, where is my chocolate coming from now? About certification of new products, the last year of the project, finally, we were thinking that, yes, we are going to move forward on this. With the COVID-19, really, are we going to make it? It looks like everything is stopped now. Concerning vulnerable communities, vulnerable beneficiaries of the project, the project managed for the last 3 years to build a confident relation that needs to be built when we approach the target, the beneficiaries. With the COVID-19 in place and the lockdown and the lack of activities, the diminution of activities, we observe a kind of loss of confidence that has been so difficult to build. Of course, the vulnerable people have problems with their purchase power. The project say, okay, we need to help, but how can we do? And the project developed an action plan on what could be done and a specific budget on that. I've been showing you various pictures. Allow me to show you two more. This is still about the distribution of the fortified floor, but look at this. Definitely, we have also to think about our dear and often suffering elders, particularly in the COVID-19, as we all know, but it's good to remember it. They are particularly affected as well with the COVID-19 in Madagascar. So the project developed an action plan with a budget, thinking, okay, rightly, EU is our partner, so we are going to submit this action plan and this budget to the delegation. We say, yes, we are going to help you. This is the last year of the project, so we are going to work with you to do, but there's still a but. The but can be spoken later on if necessary. So as a conclusion, I would say that with little support from EU, and we need to show some flexibility. Possibly the budget support might not be the best way to answer some constraints facing by governments. Food fortification is definitely an effective way to address micronutrient deficiencies. Certainly in normal times, and as an agronomist, I would say then combine with agro measures to have a more diversified diet. And definitely food fortification is definitely an effective way in times of crisis like we observe now. However, what I observe is that the building of a confident relations needs to be there before. It's not just we start like this, distributing food fortification. Okay, it could be done, but the confidence built is very much helpful. And this can be done, is a strength of having a project in place, a project such as the PFOA project in Madagascar. Quickly, you know the vulnerable people, the communities themselves, they know where they are, who they are, and it's quite easy with limited funds to make the difference. And also in case of locally produced and certified as well food, fortified food, stuff, the question, of course, of supply, transport, lockdown needs to be considered, and also as well to give some room to creativity. We have all observed in social media all of what is said about COVID, drawings, jokes, and everything. But also, if we motivate our partners, sometimes new ideas do come, and we have to be there also to facilitate the creativity of the people. I would finish here. As you know, Madagascar, I mean, I think you heard about it. Madagascar has found the solution for the COVID-19. It's named the COVID Organics. There is a lot of publicity about this product. I can only tell you, cheers. I have my bottle here with me. And please, I ask you to continue taking care of you, of your family, and thank you for your attention.
Olivier, thank you very much for that presentation and the very interesting program in Madagascar and how you're seeing the importance of this. I'd like to move on to Pierre-Luc Van Efferbeck, who's the Program Manager, Nutrition Coordinator at the EUD in Ethiopia, to talk a little bit about improving the quality of diets for better health with orange flesh sweet potato. You're probably watching your clock and thinking we're never going to get done on time, and that is true. So Daryl, I really hope you don't have something booked right after this, because I think we might have to extend for about 10 minutes, and I apologize in advance for that. Over to you, Pierre-Luc.
Oh, sorry, my presentation is not starting at the beginning right now, so I'll put it there. Good morning, everyone, or well, good day, everyone. I've been asked to go a little faster probably than what I would have done, but I'll try to do my best. So I will be talking about one of those biofortification projects that was funded by the Commission a few years back as a pilot. This one is about the production of orange flesh sweet potatoes in Ethiopia, in the south of Ethiopia. So I'll do three things. I'll give an overview of the project. Then I'll give some information about the adaptation of the project to the COVID situation, and then some information about the food security issues that are happening in and around Addis Ababa, the capital of Ethiopia. Now, generally speaking, and I'm not going to dwell on this very much because you had two presentations that showed a lot of figures and statistics about malnutrition, and you might have realized that Ethiopia was constantly within the red countries, so the one most affected by malnutrition and micronutrient deficiencies. Just one figure, here we have 38.4% of stunting. It's a little lower now because the figures have evolved a little bit. There has been progress on a regular basis in the decrease of stunting, but we're still one of the countries with the highest level. This is usually accompanied by, caused by very poor diet based on staple foods and very little intake of micronutrients. Complementary feeding practices are as well not very good, and dietary diversity is extremely low. I mean, in Ethiopia, only 7% of children from 6 to 23 months are meeting the minimum acceptable diet. This is too low, and this is something we're trying to address through different programs and projects. Now, the main target group of this project are children under 2, their mothers, and obviously the whole family, because it's not, the food is usually distributed around families. Children under 2 in Ethiopia are mal or undernourished because they eat food that is poor in micronutrients, but also very small portions. There is very little intake of micronutrients, of all the micronutrients, but in this case, we're going to talk about vitamin A's. Vitamin A's usually leads to compromised immune systems and increased morbidity. That's where biofortification can come in. The general idea about biofortification is to replace basically products that are commonly produced or fairly commonly produced by new varieties that will bring a higher level of micronutrients. In this case, the Arveneflesh sweet potato has a very high level of vitamin A. Why is it interesting as well is that if you work on products that are already produced in the country or in the production system, is that you do not disrupt it as much. It's easier to change variety than to change completely system of production. And so the adoption should be higher and better. This project is implemented by the International Potato Centers with quite a few partners, local and international. They're specialists obviously in sweet potato production as well as other types of potato. And this project is testing a combination of agriculture, nutrition, and market-based approaches. So production and consumption of roots and leaves will achieve an improved dietary diversity and increase the intake of vitamin A. They also use special feeding toolkits. They've realized that by using special toolkits that allows to measure better the quality and the quantities of food, children are fed better. And then there is a very strong impetus on basically training of the mothers and the father in what they call the health living clubs. So they meet on a regular basis to talk about all these issues, how to feed people, how to improve the nutrition. And this is a key component to explain to the parents how to feed their children, because basically if we were in a malnutrition situation, it's not only because of access, but also because of lack of knowledge about malnutrition. Most people do not know that they're malnourished. In addition to all of this, also there is a strong, they're trying to increase the flow of sweet potatoes, not only to the beneficiaries in the field, in the countryside, but also to the neighboring towns. And this should improve the production levels. I mean, if there are market developments on one side, producers should increase their production, not just for their own consumption, but for marketing, and also improve their benefits, financial benefits from it. So the project works in 5 fields. There is the research, extension, the capacity building, and value chain development, and then there is also the monitoring and evaluation. In research, there is a lot of work that is done to try to understand the knowledge of the population on the vitamin A, knowledge on how they consume vitamin A's rich foods. They also work a lot on developing knowledge on vine production. The vine is what is used mostly for the multiplication and production. And also on all the irrigation systems that are supposed to be, that could be set up to improve the production. Irrigation systems are very seldom used in Ethiopia to start with. And then to increase the markets, it's all the market developments through product transformation and trials and things like that. On the extension side, then we get to the extension, because even though sweet potatoes have been traditionally produced in Ethiopia, if you want to increase the reach of the production, you need to train more people, not only with the new varieties, because they've developed new varieties that are more acceptable and more rich in vitamin A's than the previously used varieties. So you need to get people used to that as well. So a lot of demonstration plots are done, demonstrations are done with field days. Farmers are brought together to discuss, to show how the production system, improve production systems and things like that. And then also because production is one thing, but right now, until now, sweet potatoes have been used as a sort of secondary product in case of in crisis and basically boiled, so not very tasty. They've been trying also to push a lot the use of sweet potatoes into improving the recipes and doing really very nice products. I've tried them quite a few times and it's really excellent to eat. So the attractiveness of the product is improved. After that, the capacity building, obviously, in three fields: agriculture, nutrition, and financial management. Agriculture, basically new production systems, and this has to be not only done at the farmers level, but with all the extension workers, because the extension workers are the key people to expand the areas, because it's one thing to develop a project with a few thousand beneficiaries, but you would hope that at some point this will expand to other areas of the region. So you need to include all the extension service from regional to local levels so that they know what you're talking about and they can easily take over that if they feel interested in other areas. In nutrition, it's all the nutrition understanding. The quality of the product, what is it going to bring, how to use it, inclusion of the sweet potato in the normal diet, because they have also a vision on how the diet of young children should be, so you need to change those vision. And also we know very well that even if you have availability of the product, this doesn't necessarily lead to consumption. So very often you produce something and then people are going to sell it on the market if they're not used to bring it into their own, into the normal diet. So you have to do a lot of capacity building to understand what is the interest of that. And this, so we know that without the behavior change communication capacity building, basically there is not really improvement in the consumption of nutritious food. And then also in the financial management, but that's for all the systems from the vine production system, distribution system, so that you need a commercial aspect on that. And also after that, the sales towards the market. So this financial management for, I would say, the bigger producers, not the ones that are doing for their own production and consumption. Value change development. This is a key component because this is to increase the market impact and also the interest of producers towards that product. So in the different towns, they've been working with small food processors to show them how to transfer the product and how to include it in I would say other products. It can be bread, it can be, the local bread is called injera, so you can use part of the flour, the sweet potato as substitution flour. It works very well. All of these products are very well accepted by the public. But right now, we're still at a fairly low level of consumption. These are things that need to be continued and increased. So development of sales into the main towns, market promotion events, and also the development of production, because the original beneficiaries of these projects were very often small producers. And if you want to reach a much bigger market, you need much bigger production. So they've extended the reach of the project to neighboring areas of towns where bigger surface area of production are available to try to get more volume. And then there is the monitoring and evaluation component, which is key in understanding actually how this project works, how it can be increased, and also to see, I wouldn't say if the interest of extending, of doing new projects in biofortification, but how to best do them and justify it to donors as well. Now, you know, these, sorry, maybe I should come back. I haven't finished entirely. Is that technically speaking, this project is working very well. It is targeting the right people and it is giving the good information. But what we're looking at in the end is that after the end of the project, something continues and extends to other areas of that were not originally covered. And that's where all the commercial part was going to be very important, but towards the end of the project, the last 2 years. And unfortunately, with the new COVID pandemic, this is making things much more difficult, because there is a lot of the market itself in towns are closing down. Restaurants have been closing down, access to markets have been closing down. So all of this is going to slow down probably the projects, and we don't know how well we will be able to reach those elements. But otherwise, generally, it has been going quite well, in all different levels. So now with the COVID pandemic, we, as Olivier was saying just before, we've asked but obviously we didn't have to ask, they naturally did this, how to adapt to the pandemic. And there were two sides to that. There was first the adaptation to the effect of the pandemic to avoid contamination. So there was a provision of masks, hand washing stations. When the meetings, agriculture meeting or vine distribution were taking place, apply social distancing, have tried to have more meetings with less people, things like that. Provide, again, when you're doing the provision of the vines to the beneficiaries, you try to at the same time disseminate messages on the COVID-19 issues, how to decrease contamination. Then also you work with all the bureaus of agriculture and all the bureaus of health to make sure that all the measures, compliance measures, are implemented not only by the project but by them, because you always need capacity building for the people that are on the ground. And there was also redirecting of some of the budgets to try to acquire a certain number of equipment, such as masks. After that, there was not only adaptation to contamination, but in some cases response to the situation. There were requests from different areas. Some of the people that were suffering most were obviously the most vulnerable people in towns. We know that in urban areas, in rural areas, they still have access to their production and their stocks. Urban area people, especially people that are working on a daily basis with revenues on a daily basis, so the daily workers, a lot of them have lost their jobs, so have difficulty of accessing food right now. So there have been some support to food distributions. More than 2 tons have been distributed through different system, university, handicapped association. So they preparing the food and distributing in the streets. Also support to bureaus of agriculture with the mass and sanitary products for the extension workers. Otherwise, the extension workers would not be able to go in the field and continue doing their work. You have to know that obviously we're getting into the next agriculture season, and it's a key moment for all the agriculture extension workers to reach the producers and help them. So it's not exactly the time to stop all of that. And also expand the target of vine producers and sweet potato producers to increase the supply to the different markets and to the towns. So these are some of the measures that have been put in place by the project. Now, impact of the COVID on food security. We mostly have information about Addis Ababa and around Addis Ababa, because they've been all the studies were usually done by interviews, face-to-face interviews and movement. But we know that there have been difficulties in moving. People have not been able to do that. So they've concentrated mostly on phone interviews, and people in towns are usually more reachable by phone than other people. All this information has been provided by IFPRI, which is based in Addis Ababa. They've got an office based in Addis Ababa, and the Commission is also funding them to do these things, not just for COVID-19. It was actually previous to the pandemic. Basically, households in Addis Ababa have been negatively impacted. Why? Because there have been a decrease in revenue, and therefore they've been buying a different type of food, less food or different type of food. And poorer households that are depending on daily access to daily work, so I would say, daily revenues have been more affected by richer households that have permanent jobs and are continuing receiving their salary even working from home. So that situation has worsened since the beginning of the pandemic. In terms of more nutritious foods have been also decreasing in use for different reasons, many times access, but also because they're refusing sometimes to take. I'll talk about that a little bit later. In terms of the vegetable trade and consumption, these are some of the factors that have been sort of assumed to decrease the trade of fruit and vegetables. First of all, there have been travel bans. So since the vegetables are coming from the countryside, access to the markets have been more difficult. Also, a lot of restaurants that have been using fruit and vegetables in the country have closed down or have had decreased businesses. A lot of people think that also vegetables are transmitting COVID because people are touching them with their hands, so they do not want to use that. It's also something that is linked to the consumption of milk, I believe. And the wealthier buyers that were consuming more fruit and vegetables have been distancing, confining themselves, so they have, again, less access to the markets and less consumption of those products. Sorry, and other things that have been happening, sorry, I didn't put, but so the decrease in income has been affecting everyone. And so the household are consuming less frequently the more expensive and more nutritious food. This is something that we know, that more nutritious food are more expensive. So in case of decrease in revenue, these are the first products that are put aside. And also there is a problem of storage, shelf life of products. So people also turn back to products that have a stronger shelf life. We've seen that everywhere, even in Europe, pastas, cereals and things like that, and are abandoning a little bit the fresh produce that need to be replaced, knowing that most people don't have access to fridges and conservation systems, Now, the situation isn't that bad, at least around Addis Ababa. First, in the countryside, people still have access to their storage of food and to their, so the situation is not very tragic at the time, but it's going to worsen. And it's the same thing in Addis Ababa. It's not yet alarming. Why? Because people have been able to change a little bit their consumption habits, but also to use their savings. But savings are running out. So the situation is certainly going to worsen in the next few months, because for the richer ones, savings are going out, and for the poorer one, work is going to work possibilities are going to decrease. So that's what we're looking at right now. I think that's it for me. Thank you very much.
Pierre-Luc, thank you very much for that excellent presentation. I think that we can talk about these country experiences and nutrition for hours and hours, and we're way over time, or we're not quite done yet, and I hope some of you can stay online to hear about the experiences in the Gambia. Daryl Sexton, who's the program manager, will share the experiences with industrial fortification. The Gambia also does have a program on biofortification or enriched crops, but today he will be sharing the industrial fortification. Thank you, Daryl. Over to you.
Thank you. I'm just setting up my screen for. Okay, so thank you for the invitation to today's seminar. My name is Daryl Sexton. I'm a project manager in the EU delegation in Gambia. I've been working principally in rural development and food security and nutrition for the last 7 years here. I'm coming to the end of my time, so I have quite a lot of information about the country and also the evolution of the food and nutrition sector and the EU's relationship with the country in general. So where is the Gambia? Well, the Gambia is in West Africa. It's surrounded by Senegal. It's a relatively small country of 2 million people. What's interesting from a food and nutrition security perspective is that it is a sub-Saharan African country. It's very close to the Sahara Desert. We see annually that the desert is creeping towards the urban areas. We're seeing in the rural areas a decline in agricultural production year on year. This is partly due to climate change, but also due to poor agricultural practices, including deforestation, lack of mechanization, lack of access to finance, etc. You know, the usual things. So we have a rural population that's under stress systemically, and a rural-urban migration that has accelerated in the last 7 years. And that is also, the migration issue is also impacting on Europe, because a lot of Gambians now have as an economic model to survive and to improve their family's food and nutrition security, a move of at least one person from their family to Europe to provide remittances back to the family here. So it's a country which is of particular interest to Europe because of the migration situation. Just to show you where it stands in terms of food and nutrition insecurity globally, you can see that it falls into the pink to red zone in West Africa. Quite a few countries in West Africa are suffering from structural food and nutrition insecurity. Gambia is not excluded from that. So what does the EU do here in the Gambia, and what has it done in the last decade in food and nutrition insecurity? Well, it was a bit of a golden decade for us in the delegation, as there was a coming together of a series of different events which permitted us to program a number of projects which we were able to work with government to tackle the underlying causes of some of the principal drivers of food and nutrition insecurity. Just very briefly, I'll start. In 2012, there was an international global hunger event which pledged the international community to tackle stunting worldwide. And they set in that 2012 seminar a global objective of reducing stunting by about 7 million. At the same time, the European Commission set up its nutrition action plan and established a number of commitments to funding in development projects around the world, and also set up the support service, TUFAS, Food Fortification Advisory Services. We then had in 2015-2016 a precursor to the current COVID crisis. We had Ebola in the region, and this allowed us to program a post-Ebola recovery action plan, which focused on food and nutrition security. We were also able to program a cash transfer project for nutrition for children and mothers. And at the same time, we were looking towards programming the 11th EDF, which was focusing on agriculture. All this generated a lot of interest in the country, and we were able to develop with government quite strong relationships with the National Nutrition Agency, and we assisted them with the support of the EU's Nutrition Advisory Services and the Assist programme to prepare a nutrition fiche, which pledged their allegiance, if you like, to the EU programming and the EU projects that we had in the pipeline. So from 2016 to 2021, we had a number of projects that were already planned, that were planned as part of the 11th EDF. We had the one that came post-Ebola. And we were very lucky also to be able to work with the partners here locally in preparing the proposals for the call for proposal on food fortification. And we were lucky enough to get 2 projects into the Gambia, which is unusual for a country which is so small, on food fortification, one on biofortification and the other on industrial fortification, which is what I've been asked to talk about. So in all, we had a 40 million euro programme that's been implemented since 2016, looking specifically at nutrition, food insecurity and agriculture, and with an overall general target of reducing stunting. We've already seen in the country, through statistics that have come through in 2018 and 2019, that we've been successful. Maybe it's not just EU projects, but it's clearly attributable to some of the activities in reducing stunting in this country. We've gone from a stunting rate of around 1 in 4 in 2013 to a statistically proven stunting rate of about 1 in 5. So it's dropped from about 26% nationally to around about 20%. So we've had some interesting achievements, but of course now we have COVID. A little bit about the food fortification support. Well, we had 2 projects that came into the Gambia, one on biofortification, the other on industrial fortification. Of course, when you've got 2 projects, they tend to work independently, 2 different implementing partners. One was an NGO, the other one was a UN agency. And where we've had great support from the food fortification TUFAS is that they've been able to come in periodically and provide trainings to bring the 2 implementing partners together with government implementing agencies, but also to do evaluations and to troubleshoot and to see where either of the projects is not performing well and to make recommendations. So TUFAS has provided very valuable input to the overall food fortification project. Now, the 2 projects that we have, one is on biofortification, which I'm not going to talk about in a great deal. It's being implemented by United Purpose. And the other one is on industrial fortification. It's being implemented by the FAO. They do have under the FAO projects a small biofortification component, but that's really not the mainstream of their activities. They're principally concerned with the regulatory, the standard setting, and the implementation of standards around industrial fortification of wheat flour, salts, and vegetable oil. So the next slide. So who are the main actors in the industrial food fortification projects in the Gambia? Well, effectively, the nutrition policy in the Gambia is defined by an agency called the National Nutrition Agency. They don't fall under the Ministry of Health. They fall under the Office of the Vice President. It's seen as being an area which is that important for the government. The second actor in the industrial food fortification panorama is the Gambia Standards Bureau. And the third actor is the Gambia Food Safety Quality Agency. The Gambia Standards Bureau, with the assistance from the project, has defined the food fortification standards. These were based on ECOWAS standards, but also recommendations from the WHO. The procedure is that once you've identified what the standards are, you then submit them to the WTO for approval, which is what's happened here in the Gambia. We're currently waiting for WTO approval. Once that's given, the standards are then sent to the National Assembly for assent into law. We currently have a law on salt iodization, which is seen as obsolete because it's only on one specific product. We're hoping with these extra products we'll have a more relevant and up-to-date fortification law, which would then have to be enforced by the Food Safety Quality Agency, the third agency on my slide here, where the project has also assisted not only in the definition and pushing through a bit the standards, it's provided training to both the Gambia Standards Bureau and also the FSQA. Principally, FSQA is important because they have to enforce the standard once it's been set. The project implementer has also provided checks, instruments, different scientific instruments for checking the quality of the different products that are being fortified. iCheck is, for example, one particular product that they provided to government. So here are the standards. You can see we've got 3 products that are being targeted: wheat flour, edible oil, and salt. With wheat flour, there is a choice of different additives that you can put into the wheat flour. What we have in the Gambia is wheat that's imported whole grain. We have 2 milling corporations in the country. They process it and they add the additive. At the moment, it's being done on a voluntary basis. Once the standards are set and the law is passed, then obviously it will be a bit more enforceable. Edible oil is coming in bulk. What we've noticed from evaluations done by TUFAS is that it's very difficult to identify the quality, or people testing for the quality as on importation of the vitamin A contents. And there's quite a lot of work that's got to be done on actually identifying how to ensure that the edible oil that's sold through many of the local shops and in the markets here is actually rich in vitamin A. The salt is mainly imported from Senegal, where it's fortified. Again, we've had a micronutrient survey that was done in 2018, which identified that a lot of the imported salt was not particularly well iodized. So there's some work to be done there, especially on the checks on the importation. I'll talk a little bit more about where the iodine uptake of the population is actually coming from in the absence of the proper salt iodization. Specifically for the flour, the main product that's being consumed from the flour is bread. According to statistics that we have in the delegation and also provided by TUFAS, everyone in the country eats bread, although not in large quantities, they do eat it. So the flour that's processed by the local milling mills, enriched with vitamin A, that is reaching a large percentage of the population. Iodized salts, as I mentioned, the salt that's being imported so far is not particularly well iodized. However, what we've managed to identify is that a bouillon cube, which is used extensively throughout the country as a flavor additive, is actually iodized with iodized salt. Whether this is on purpose or just by mistake, it is an underlying reason why the problems related to lack of iodization are not recurring here. I think goiter is one of them, and we don't see goiter in the Gambia. So it's attributable, we believe, to widespread use of bouillon cubes. So there's possibly an avenue to promote that in the future. So moving to the actual COVID situation in the Gambia, we currently have today 24 cases. 12 have occurred in the last 12 months. So from that, you can deduce that the COVID situation here is accelerating. They're mainly imported from Senegal, so they're not community transmissions. But nevertheless, the government has reacted by declaring a state of emergency. It's been in effect since the end of March. At the beginning, the state of emergency required all of the non-essential food outlets to be closed, leaving just essential foods, smaller markets in the town. All of the markets outside of the major urban areas have been closed. The state of emergency is up for review this week. It will possibly be extended for another 21 days based on the National Assembly desire. There has been a partial release of the lockdown. The reason being is that it was becoming increasingly clear that it was impossible to enforce a lockdown. So you declare a state of emergency, but 90% of the population in this country don't work in offices. They work for small and micro-sized enterprises, or they're agricultural farmers. And so they've pretty much, after the first week, gone back to work because they've got to provide themselves, their families, with some sort of food. Just the lockdown itself has led to some form of economic crisis because it has impacted on people's income and income making abilities. So you could say, in a sense, that given there are only 24 cases in the country of 2 million, the economic crisis has come before the health crisis. That having been said, the government has recognised that there is a potential imminent food crisis in the country. As I said earlier, we're sub-Saharan. We have a structural problem in the rural economy due to climate change and poor practices. And they've already started on food distributions based on the food insecurity assessments done by the Cadre Harmonisé. This is the SILS based in Burkina. And projections from the WFP, which recommend that there will, or believe that there will be up to about 40% of the population falling into food stress situation between now and the harvest of the coming agricultural season, which is about to start next month with planting. Provisions for the rain are quite good this year, so we wouldn't expect, under normal circumstances, for it to be a major failed crop. However, with the state of emergency, we do have no flights coming into the country, apart from the occasional evacuation. All the land borders are closed, with So we only have food and commodities coming in through the ports. What I've understood from FAO is that in the run-up to the planting season, ECOWAS has agreed amongst itself to allow a temporary opening of the borders to permit fertilizers and possibly seeds to come through to farmers in the case that they're not allowed to, can't find them, source them locally. I believe that in the Gambia, they will source a lot of the seeds here. In fact, and FAO has told me that they believe that there's enough here to ensure that the harvest can be planted as usual. WFP are predicting that with the 40% of people moving into food insecurity, they are working with government on a food distribution. They've said that they've got in the pipeline with government 9,000 tons, but that will be coming into the country on time. The only problems that they have right now are who's going to pay for the logistics. Just more specifically on the impact on food supply chains. Well, in the agricultural sector, we have two seasons. We have the market gardens that produce during the dry season, and then we have the cropping season. We're just coming to the end of the market garden season, and there's a lot of produce available in the market gardens, but they can't reach the markets because the markets have all been closed by the government. But I do believe, having spoken to FAO, that, should we say, entrepreneurs will find a way of getting to those market gardens and bringing the produce to the urban areas. There's been a definite supply disruption for the horticultural products from the market gardens. We believe that with the upcoming planting season, the provisions that ECOWAS have put in place for access to fertilizer, the fact that seeds can be procured locally, should mean that the planting season can go ahead. However, with social distancing and sort of generally people being a little bit scared about the COVID, we are concerned about whether the right sort of labour will be available to actually do the planting. So that's a little bit about the situation in the Gambia. There's been a national response, and this rather complicated slide shows how the government have divided the response to the COVID into four pillars. One is health. It's principally obviously a health issue, and a lot is being done by the Ministry of Health, who are taking the lead there. Agriculture, food security and nutrition hasn't been identified as a main pillar. It's falling under social protection, which in a way makes sense to myself, having worked there, because a lot of the food and nutrition projects that we've worked on here have led into social protection work. So that's headed up by the Office of the Vice President and co-chaired by the National Nutrition Agency. Then there's a third pillar on the socio-economic impact, which is the Ministry of Finance, and concerns related to the rule of law. So they have a national structure platform. They do things like the Zoom meeting, and they discuss and they've made pledges. And as I was saying, under social protection, there's been distributions already done by government. Similarly, under the health and social economic impacts, there will be similar activities. So I just wanted to finish the presentation, which I tried to keep brief, on what I find is a very, very important visual image of malnutrition. It's principally linked to the zinc and it's stunting. It's what we've been trying to eliminate, or at least reduce here in the Gambia. A lot of people, because it's hidden hunger, they think, oh, I can't actually see, the impacts of not getting the right form of micronutrients into my nutritious diet. Well, here is a CAT scan. It's a cross section of a child's brain at the age of 3. You can see on the left how a child, which is developing normally, how its brain looks normal. The thickness of the skull is relatively okay, but on the right, extreme neglect, poor nutrition, and 1 in 4 cases of people in the Gambia were in this case on the right 7 years ago. I'm glad to say that prior to COVID, we were down to 1 in 5, less than 20%. But nevertheless, it's a situation that you want to try and avoid because, of course, once you're stunted, it means that you find it difficult to learn at school, to keep your concentration levels up, to get any sort of job and to be productive in any form or way. So really just a visual image of what we're actually talking about. So with that, thank you. Greetings from the Gambia.
Daryl, thank you very much for that very comprehensive presentation. So we are over time, and for the Q&A, I have to say we only received 1 or 2 questions. So we're not sure if people don't have any questions or if the box of the Q&A wasn't very clear. But first of all, I'd like to say that you can always contact us via email regarding any questions. At the same time, we've changed the program a little bit, and Fadwa will give some closing remarks, and after that we will have a general discussion. We will be able to unmute you. Of course, we recognize that this is not in your calendars and you may have other commitments, but if you can stay online and you would like to participate in a discussion rather than chatting, please do stay online. I think that we will have this raising hand and you'll be unmuted. If any panelists need to go, we completely understand. Please do not feel like you need to stay. Yeah, I will turn it over to Fadwa to give some closing remarks and maybe explain a little bit more. Thank you, Fadwa.
Thanks, Dora. So I have the honor to make the conclusions of this webinar. I'll try to make it short and summarize the key messages. And also I will try to give a few words about the way forward. But first of all, I would like to say thank you to all of you who are participating. It's really great to have colleagues from so many countries in the EUDs. It shows really your interest in nutrition and in this really nice tool that we can use, food fortification. Then, of course, a big thank you to all of the speakers, the panelists, really nice presentations. And thank you to TooFast team who really helps to organize this webinar. So I would say that we had kind of 2 sessions. In the first session, we had a presentation of the great picture where food fortification fits within the nutrition package and where actually nutrition is actually fitting in the farm to fork and in the Green Deal strategy. Then with the following presentations, we had a better idea of why micronutrient deficiencies can have a real impact, I mean a bad impact on health and on the nutrition status of vulnerable people. And with the mapping, we could identify in which countries you have food insecurity, problems of lack of hygiene, health issues, and combined with the risk of COVID, how it actually really increases the risk to be even more malnourished. We could also see the issues of disrupting the food supply because of this distance, I mean, social distancing, which have been applied in so many countries, and the impact of this social distancing on not only the food supply, but of course on the fact that families, many of them cannot access to nutritious food and go to buy only staple foods, which are not the most nutritious. Then on the second session, we had the presentation from food fortification projects, and I was really glad to see very concrete examples of projects that the EU is funding in 3 different areas of Africa. It was really great to see that we have an impact on the nutrition status to improve it, of course, but also an impact on the economical aspects. It is good to see that it's creating jobs it is a great way to link with the local private sector. And by saying private sector, we're of course aiming at the SMEs, so the small, medium enterprises, and even in some cases, which were not necessarily presented here, but in other pilot projects, we have small groups of women who are very vulnerable, and thanks to this kind of projects, they can have a job and have an income, which is making their situation more stable. So it's really good for the empowerment of women. Regarding all those projects, I would say that it is possible when you have the nutrition policy in place, and it is really important that it is still high on the agenda of each of the EU delegations. As you could see in the first session, COVID-19 has a very bad impact on malnutrition, and the mapping that Florencia was showing on food security and nutrition insecurity were actually mappings made before the crisis. So we can only imagine how it will impact badly. So please do not hesitate to come to us and to Too Fast team, who are the experts on food fortification, if you need any support to try to see how you could eventually implement food fortification projects. And first of all, to answer to the question, is it actually adapted to the context where you're working? Yes or not? And regarding that, actually, we are currently working on a guidance on food fortification to be able to analyze your own context and to see what is possible to do, if it's possible to do food fortification programming, and which kind of food fortification is adapted. Because as you could see, there are different kinds. You can have the agricultural projects with nutrient enriched crops, what Pierre-Luc was showing in Ethiopia. You can have industrial fortification, such as Darrell and Olivier were showing in the Gambia and in Madagascar. Voilà, so you have different types of projects. And so really do not hesitate to come to us. We'll be happy to help you on that. Too Fast team is here for that. We also have the team of C4N, Capacity for Nutrition, sorry, where our experts supporting all of us together on nutrition. And now, because I think it is a very great opportunity for all of us to discuss together. It's not every day that we can have so many nutrition focal points from so many EUDs together online. So I would suggest, as Dora was saying, that whoever would like to jump in, ask questions or comments or whatever, share their experience of their own country projects, you can just say it on the chat that you would like to say something, and we can unmute you, and the conversation can start. Voila, thank you. So I don't know if India, you can actually unmute the few persons who have said that they have comments here. So first, I see that colleagues are asking for the presentations to be shared. Yes, we will share them. And this webinar has been recorded, so we could share it. I can see that Michelle is asking a question about the focus on food and biofortification. If she can be unmuted, it would be great, so she can ask a question directly. I don't know if I can do that.
Maybe while we're trying to figure that out, there's a question for Leonard. Leonard, I think you're still online. The question is for you. If you could the question is, will the EC continue to invest in food fortification in the future beyond the current pilot projects?
Okay. What we are going to do in the coming days is we are preparing a guidance note on food fortification, which we would like to share with delegations. First, we need to have it cleared by our senior management. The idea of this guidance note is also to give a bit of a pathway of what we can do, what we might do, building up on the experiences to date. We are in the end of the current financial programming. We are now going to enter, as colleagues from the delegations know, into programming once we have clarity on the MFF in the coming months. So it is also given that most funding from 2021 will be geographized, meaning that we will not have as big portfolio in a global public goods steered from headquarters. And the experiences that I heard from the 3 countries, and hopefully from the portfolio we have with the 40+ countries on nutrition, the triggering dimension should be made at country level and regional level. So, and with a clear priority on the African continent, but not only, to try to create those local and regional dynamics that I mentioned. If we really want to re-dynamize, to have a post-COVID recovery, which stimulates those mechanisms at micro and small and medium-sized levels, having also a triggering aspect from the guarantees, the EFSD, and all the experiences we have with blending, I think this is the opportunity moment and the window of opportunity in the coming months. Otherwise, as we know, there is so much competition for funding out there. Without naming and shaming any sectors, the risk is always that this falls into the cracks if we don't prioritize it at delegation and by the geographical colleagues. So we can accompany this process as long as there is a demand to be steered by the delegations themselves. Over.
Thank you, Leonard. I think you've kind of answered this next question, which is, given the magnitude of the impact of COVID, would the Commission consider a commercial approach to tackling the problem? Would it be possible to mainstream blending instrument to accelerate country level response?
We are doing this. However, we also need to have de-risking agriculture, especially small and medium-sized enterprising, is always proving to be a challenge. I can't overemphasize how difficult it is, especially on small ticket sizes below 1 million. Financial institutions have limited appetite, and with COVID, that appetite needs to be even more nudged. So we need also to work closely with delegations. There isn't a massive pipeline coming into this area. Let's be honest and clear. The demand is relatively easier on other sectors like renewable energy, because they are bigger projects where the return on investment is bigger, where the value chains are more tractable, whereas the agri-value chains are more complicated because they involve small operators, highly fragmented markets, where the role of retailers, wholesalers squeeze the small farm holdings. So through farmers' organizations, through better vertical integration, through better integration between farmers and agri-food companies, even SMEs, but building up on the portfolio that we have, like the ABC fund, like Agrify, we need to have better push from delegations with our EDFIs, with our financial institutions. Otherwise, we can't reach those most vulnerable who are a bit distant from bankability. So the appetite or the portfolio is there. It's a question of what appetite the financial institutions have to make them bankable.
Okay, Leonard, thank you very much for that. I think we can go to Michelle's question. I think I'm going to actually ask Saskia this question. So there's a strong focus on food and biofortification. What about bioavailability of fortified foods? Other food safety issues? Need to balance also fortification versus increased focus on undermining the promotion of already nutrient-rich indigenous foods. Would you like to please comment on that, Saskia?
Yes, thank you for this question. I think in my presentation, what I said with regard to the different intervention strategies that we have to promote micronutrient nutrition, it's important that these interventions are not seen as to replace each other, but are seen as parts of the puzzle and should be coexisting simultaneously next to each other, because we know that every single intervention by itself will not be sufficient to address micronutrient malnutrition adequately. So yes, in addition to food fortification, we also need to continue to promote the importance of a dietary diverse food, and if that can, in some contexts, that can include the promotion of nutrient-rich indigenous foods as well. And I think, but as I said, we also know that for particular nutrients, such as, for instance, iodine, particularly in areas that are far from the coastal areas, or for iron, it's quite difficult to consume sufficient nutrients from your diet, from the local diet, and particularly, you know, when you are not able or cannot afford to consume sufficient nutritious foods. And in those contexts, food fortification has been proven to be an effective way of increasing the intakes of certain nutrients. So it should not be replacing a high quality diet. I think that's one important message. Then the question on bioavailability of fortified food in most, I guess you mean whether the nutrients that are added to the food can be absorbed adequately to the in the body, and that's been taken care of. So, for instance, in the case of iron, which is a difficult nutrient to absorb in the body, there are strong regulations in place for certain types of iron that can be added to, for instance, wheat flour. So I hope this answered the question.
Thank you, Saskia, for that. There's another question for Leonard. Leonard, a lot of questions on this funding. Could we foresee a bigger role for the European investment plan post-COVID-19?
From the European Investment Bank?
Plan. EIP.
The EIP. Again, it's the same. Money, I always say, money is not the issue, is not the problem. The guarantees, the blending, it's a question of how to create the bridge between bankable projects and the financial institutions. So in a practical way, what we need is a nudging dimension between a delegation, a number of pipeline projects, and the financial institutions, the AFDs, the FMOs, the Cassa Depositi and Prestiti of this world, the EIB, to actually finance bankable pipeline projects. Because we have unveiled in the last 3 years through the EIP, and this will also be scaled up, also because you can't have in a COVID structural change without accompanying it with a recovery process which has to be robust, but which has also to be green. That is part of the solution, but it also has to tick the boxes of inclusivity, equity across the value chain. When financial institutions start ticking lots of boxes, especially on inclusiveness, on equity, on reaching the weakest links, they tend to find investing in small and medium-sized enterprises of agri-food extremely complicated. So it is our role to de-risk that and to find the right instruments and to tweak them to actually reach more the food fortification potential. So yes, conditional on the financial institutions to play ball with us.
Okay, thank you for that, Leonard. We did receive some questions in advance of this webinar, and I'd like to ask colleagues from the country offices to share that these projects were considered pilot projects for the EC. What have you learned from these projects, and how do you see this in terms of moving forward in your respective countries? So Olivier, may I ask you first about some of the main learnings and if you see this in your next country strategic plan?
Yes, thank you, Dora. The learning are many, I would say, and especially we are going to have, in the context of the project, a lot of learning from the component which is producing evidence on the effect on growth on fortification. Those results we are going to get them by the end of 2020. But definitely all the interaction that the project generated with the national authorities, with the beneficiaries, with several people turning around the project, being actors or beneficiaries. Definitely this is coming into our next programming, and we do take the project as an example for the programming on what could be done in nutrition as well as in the health sector and social protection. Definitely, yes.
Okay, thank you. Pierre-Luc, could you please comment from Ethiopia?
Well, first I would like to say that even though it was shown as a pilot project in biofortification, the orange flesh sweet potato, there has been a wide knowledge about how to do these things, how to do these projects, and the interest of these projects. So I guess it was a little bit more of a pilot project for the Commission to decide on its future involvement, but not on the validity of these approaches. Again, we were working with the International Center for Potato that do know how to do these things. So they have technical capacity to do these things, and they've been doing it in different areas. But what in the end is important is not to look at how to produce sweet potatoes in general, but how to adapt it to a local context. One of the things that they've been working on quite a lot is to adapt the varieties, because the varieties that were available were not adequate to the needs in vitamin A or to the tastes of the consumers. So they've been able to develop new varieties, and then there's the whole process of to accept these new varieties in the system. So this in itself took quite a long time to take place. And then I see it more of a how to adapt to the local system, so institutionalization of projects in a certain sense, because we keep on developing projects that are reaching a certain number of beneficiaries, but how do these projects do after the end of the contract, when we stop funding them, when we stop injecting a lot of money in these things? Who is taking over? Who is thinking about, this is interesting, where can I get the information? So institutionalization of the knowledge and of the training. And this is something that the project has been working quite a lot, unfortunately, as I say. So there's working with all the structure of extension, developing new varieties, and also trying to link it much more to commercial aspects, because you need a sort of push and pull factors. You're pushing through technical systems, and you're pulling through appeal of the market. If these products become widely consumed on the local, on the urban markets, for example, there will be probably a lot more desire for small producers to contribute and to produce these things. If you keep them as a sort of secondary food security product that you use from time to time because you don't really have any other alternative, then you will never reach a certain level of production and understanding and knowledge. So I think it's very much more about these system adaptations than anything else, but not about whether we should do food fortification or biofortification or things like that, which I think has been shown and proven as efficient in many areas. After that, just to jump on another thing, for example, we're trying to push as well industrial fortification. But then again, we get, depending on the countries, from Gambia, it's a small country, easy reach of the different areas of the country, I would imagine. In Ethiopia, it's a very big one. And we know that 80% of the population is still rural, and maybe out of all these people, 60% still don't usually access markets. So if you want to push industrial fortification, you know that you will restrict yourself to a certain number of people that are more urban or more urban and peri-urban, or that have access to market and that will buy those products. Most people are still producing the oil themselves or the flour themselves. So they will not access industrial fortification. So that's where we need to always understand the specificities of a country compared to the general concept and principle.
Okay, Pierre-Luc, thanks very much. Daryl, I wonder, could you touch on this issue of sustainability of food fortification programs and how you see that in the Gambia?
Okay, sure. I'd just first of all like to say a couple of words about the rationale behind industrial fortification. It's something that started in Europe, I believe from my research, that it was about 100 years ago in Switzerland. And the logic is that if you can identify a product that's consumed by the vast majority of the population, it's a very simple and easy way to improve their nutrition if you can fortify at source. So the logic is there. The problem in the Gambia, to go on to your issues of sustainability, is more related to enforcement. We've had since 2006 an iodine fortification law in the Gambia, but the micronutrient survey that we did in 2018 under one of the projects we managed found that the level of iodized salt in people's households was actually under the prescribed limits. That's when we got into the issue about the bouillon cubes, because we realized that there was no sign of goiter. So they were getting their iodized salt from another source. But we had a law, but it wasn't being enforced. That apparently at the border, people just didn't check to see whether it was iodized or correctly or not. So I think in terms of sustainability, you can put in place laws. Your logic can be great with industrial fortification. You can reach a large percentage of the population. In this country, everyone eats bread. There are shops everywhere. Everyone has access to oil. Most people use the oil out of the shops. They don't always produce their own oil. So you can have a very high coverage, but is the quality of what you're selling linked to the standards, and is it being enforced properly? That's the problem with sustainability there on industrial fortification. On biofortification, because we do have a biofortification, a big one here with an NGO United Purpose, the problem there is more to do with cultural norms. The orange flesh sweet potato is being introduced here. It has been introduced in the past about 10 years ago. When the project finished, consumption dropped. In fact, it pretty much disappeared. So we've reintroduced it in the second attempt. And a lot of research was done on the varieties that the NGO produced to try and match it with the existing varieties of white flesh sweet potato that the population does consume with a dish of rice. So the jury is out on that one, whether they will be able to change cultural norms in what people actually consume as a habit. There's another area that they're working on, which is millet. And they're encouraging people to cook the millet keeping the husk on, because the husk is rich in zinc. Again, that requires cultural change, because people here ground the millet and they get rid of the husk and feed it to chickens. That's why the chickens are healthy in Gambia. So, you know, there are issues there with sustainability. But I think what I think needs to be done, and maybe this is something for Brussels, is that we've already had an example of an epidemic in Gambia. We had the impact of the twin shocks, in fact, of the 2014-15 Ebola crisis. That affected tourism, it affected the economy, but it also affected we had a drought in the same year, sorry, that which affected the agricultural output. And we put in place, under the envelope B of the 11th EDF, a comprehensive resilience building approach which had a nutrition focus. So we worked with a number of UN agencies on rebuilding people's resilience post a double shock. Why can't we do the same sort of thing post-COVID, recognizing that there's been an economic setback for the vast majority of poor populations in these countries, and have some sort of Marshall Plan to build people's resilience and put them back on their development curve.
Thank you, Daryl. Leonard, would you like to respond to that comment, the question from Brussels? Did you catch it? Leonard, I can see your number there, but I can't.
Okay, sorry, because I couldn't catch it. The synopsis, please.
Yeah. Yeah, okay, Daryl, could you just please ask the question directly to Leonard?
Yeah, we've had in West Africa, as you know, Leonard, in 2014, we had the Ebola crisis. Here in Gambia, we also had a failed crop because there was a drought that particular year.
Yes.
And the response of the EU was comprehensive. We got a big allocation from C1 for the country to work on a resilience building project with a nutrition focus. It looks simultaneously at agriculture, at nutrition with supplementary food distributions to children under the age of 5 and specifically under the age of 2, focus on water and sanitation, working in the health centre, screening for GAM and SAM. There was basically, it was like a Marshall Plan for the Gambia post-Ebola.
Okay.
Why couldn't we have a similar sort of logic post-COVID and do something a bit more structural to try and put people back on the development curve that they've been knocked off by this health and economic crisis, which we're currently going through?
At the moment, we are receiving country flagships, either around energy or around Green Deal. Nothing stops the delegations, and I have to repeat, to put issues around food systems, nutrition, food fortification within a green recovery concept. I haven't seen many proposals in this direction yet. Today, C1 doesn't have any more a portfolio. The only portfolio we have in the pipeline is the AAP 2020, which, as you know, is the last shot. We can look into the PROACT or PROACT typology. As you know, PROACT typology will not do what we are discussing now. These are more medium to long term, whereas PROACT is more the interface between humanitarian and development. So it is, again, up to the delegations to come up with any green recovery plans which have within them the aspects that we have been discussing over the last 2 hours. Unfortunately, the few that I have seen coming from delegations don't put this at the forefront, because we are trying to do loads of things, but this is a key component of human development. We can't not overemphasize that if we don't invest in the first 1,000 days, if we don't invest in agri-food systems where you have diverse diets, we will not have productive jobs at you who are really going to compete in the global environment.
Leonard, it's really hard to hear you. I think we're sort of losing you.
Are you hearing me now?
Yeah, that's much better. Thank you.
So basically, it is important to push the food systems angle and the job creation angle in agri-food SMEs strongly in your flagships, which will now be Team Europe alliances, and actually prepare well for when the programming is finalized. So I think what we can do with our support services is to accompany you to actually trigger this dimension in the recovery process that inevitably the programming will have to focus on in the coming 12 months. Over.
Thank you, Leonard and Daryl also. I have a question for Saskia. Saskia, you heard there are a lot of questions about budgeting, planning for the future. I know that you're doing some work with the Micronutrient Forum. Could you please share a little bit about what the work that you're doing right now, how that could help inform European delegations?
Yes, I think it's so with the Micronutrient Forum, but also with GAIN and many other nutrition organizations and the UN organization and UN nutrition heads and the scaling up nutrition donor countries. We have been working on preparing a united call to action for food and nutrition security. And at this moment, as I explained in my presentation, we are also working on more detailed analyses on the impact that COVID has on food and nutrition securities. These analyses will be presented first on a global level, but we will have the ability, and therefore, if you are interested in due course, you could approach me to also project country, to model country projections as well, and to come up with a set of recommendations what needs to be done. And the idea is that this needs to be fit into this call of action. So within the next 2 or 3 weeks, I don't know exactly the timeline. It depends a little bit on how quick we can derive some of the early numbers. The 4 UN nutrition heads of UNICEF, the World Food Programme, the WHO and FAO will together publish this call to action, and we will feed that then with this large nutrition ad hoc coalition that have come together because everybody is so concerned now that, as Leonard said, nutrition will again fall between the cracks at a time, and we really cannot afford that when COVID is actually derailing all our efforts that we've made so far. So we will accompany that then with a note with a bit more technical details and some numbers, so that can be helpful, I think, for the country delegations to feed into your plans and or to use for local advocacy efforts as well. And I will share some more information on this after the call with the organizers, so that they, and also with Dora, so that they have that information at hand if you're interested to learn more. And then over the summer we will come up with more thorough analyses based also on some of the real-time effects that we see happening in countries now. Over.
Thank you, Saskia. Okay, I think that we will be concluding this webinar. Let me just say that many thanks to our panelists for joining us today and sharing experiences and the presentations. Many thanks to all the people who joined from all over the world. I was absolutely delighted that you could participate in this. As I mentioned earlier, please do not hesitate to reach out to us. We will be sharing the presentations, and we'll answer any other questions that you have. With that, I wish you all, well, for those of you celebrating Ramadan, wish you a wonderful Eid coming up, and others happy Accession Day, and others, and all of you, please stay safe and well, and we look forward to being in touch with you in the coming days and in the future. So all the best. Take care.